Hi guys, my name is Donnie Clark. I'm a nursing student at McKendree University. I'm also a nurse here in the ICU. Um, Thanks Sherry and all the other nurse practitioners for letting me use their office to do this, and thank you guys for taking some time away and doing this with me. I know you guys are all waiting for your doctor's appointment and probably have things to do, so thank you for that. The purpose of this presentation is to introduce factors that affect cardiac health and maybe give you guys information that will help you make better choices or maybe improve your cardiac health. I know since we're here in a doctor's office, some of you might already have cardiac issues, but maybe we can do something or show you something today that'll help make that problem a little less than what it is. The objectives of the presentation is by the end of the presentation, hopefully all of you, but at least 75% of you, know how to take your blood pressure and then know how to read it and like actually what it means. And also by the end of this presentation, I'm hoping that same percentage, 75% of you, hopefully all of you can identify 2 resources available to you to help you. You know, these resources are tools. They have checklists and stuff that when you go to the doctor's office, so you have questions and things like that, but we'll get into that in the presentation. And also the last objective is by the year 2017, we'll hope to reduce the smoker rate by 10% amongst hospital admissions. I know there's a lot of you, there's only 4 of you, but hopefully by enabling you guys can pass this message, and if any of you guys have family members at home that smoke or any of you guys that smoke, you can go home and pass this on and maybe it'll spread like wildfire, maybe we can reach our goal. Alright, so the first thing I want to go over is I have it set up in a PowerPoint presentation, and it's only a couple of slides. It shouldn't take too long, so we'll go ahead and get started. So the name of the presentation is Keys to Cardiovascular Health, Enabling the Population to Make Healthier Choices. The first thing that we're going to watch is a video about how to measure your blood pressure, and I have a couple of cuffs here that we can kind of go along with the video and get your blood pressures. And if you're at home and you don't have a blood pressure cuff, you can get one at Walgreens, Walmart. There's automated blood pressure cuffs that you can get there as well. They're a little more expensive, but they just kind of fit over your wrist and they can measure your blood pressure. So we're going to get started.
So after we take the heart rate, we move on to blood pressure. And so there's some equipment that you need to have prepared for this. This is the blood pressure cusp, and so this whole black Velcro thing is what you wrap around the patient's arm. And you have the pump right here, which you pump up to put air in here, and that's what gets it tight around their arm. And so before you begin, you gotta make sure this is twisted all the way to the right, righty-tighty, lefty-loosey. So when you have it all the way to the right, that's how you close it off so that air actually pumps into here. Otherwise, you'll keep squeezing and nothing will be happening. The meter, so when you pump it up, you can gauge how much air you have in by how high the numbers are. And you listen for the pulses with the stethoscope. When you put it in your ears, make sure that these prongs are facing forward, not backwards. Even though that's what you think it should be, you face it forward. And double check to make sure it's on by twisting. You can twist this and tap on it. So you hear, right now it's not really making a noise in my ear, but when I twist it, then I can hear it. And so that's how you know if your stethoscope is on and working. Otherwise, you might be sitting there and be thinking this person has no pulse, when really your stethoscope is just turned off. And then you have the patient put their right arm up on the table, and we use the right arm just for consistency throughout all the tests. So what you're going to do is you're going to try to see if you can find a pulse on the brachial artery. It's usually towards the inside of the elbow, around here.
Might be set it up like, yeah.
And you kind of just take a little mental note of that. And you're gonna wrap the cusp around their arm. Keep it snug but not super tight. You just don't want to have it loose and wobbling around. So you put these in and put the head of the stethoscope right where you had the pulse. And double check to make sure this is all the way tight. And you're gonna squeeze. And by doing this, you pump air into the cusp. So I'm gonna pump it up again just so you can see in the camera what's going on. So we have it up to about 200, and then we slowly let some air out. And that's where I heard my first thump, and you can see the dial bouncing up and down. And the last thump I heard was about 64. So I got about 118 over 64, because that's where I heard my first
That's a
thump.
good one.
Heard more, watched the dial bounce up and down, and about 64, I didn't hear anything anymore. But essentially what you're looking for is when you release the air, you'll see the dial go, and you'll begin to hear.
You want to make sure, you didn't say it, but you want to make sure that you kind of loosen it out really
That's just
slow.
kind of an average. Some people might be a little higher, a lot of people are lower than that. And what you're hearing here is the first thump is their systolic pressure, so that's when the heart has contracted and that's their highest pressure. And you'll continue to hear light thumps, and the last thump you hear is the second number you record, and that's their diastolic pressure, and that's when the heart is relaxed and it's refilling with blood.
Okay, any questions? Okay. Can we use your blood pressure? Is that alright?
A lot of times people are a little scared.
Sure.
It's kind of more challenging one, but with a little bit of practice, you guys will be stars.
What was your blood pressure?
138 over 86,
And how old are you?
40.
Alright, so I'm just going to use one of the tools real quick. It's actually the next slide. Alright, so I got the link on here, but we'll go ahead and get out of this. Alright, so you're female, you said you're 40, and your top number was 138?
138.
Okay, are you currently, that's kind of borderline hypertension, do you take any blood pressure medications?
No, I do not.
Okay, do you smoke?
Yes.
So you are a smoker. So you just enter this information and then you just push calculate and go through. So it's saying right now that you might be 40, but your cardiovascular age is 56. You know, and smoking is going to contribute to that, and you're not taking any blood pressure medications for that. So all those are contributing factors. Okay, I'll go back to the slide. So thank you. for that.
You're welcome.
Sorry. Okay. Now another thing. Uh-oh. Well, that's loading up. Sorry about that. Alright, so another thing, and I kind of take some things up here on the wall, and you can get copies of this online, or we can probably make copies for you at the office of these things. But one of them is just like a visiting checklist. It's ways that you can kind of take control of your own cardiovascular health, and you can go in with almost, let's say, like a loaded gun into the doctor's office because you have all this information and you have your questions ready. Anything you want to know, they're available to you. All right. So basically, it's saying don't be afraid to ask questions, and then when you go in there, make sure that your questions are prepared. You know, this is my blood pressure, but what's my goal? What can I do to make it better? Do I need to take any medications? Things like that. Again, this is available on millionhearts.hhs.gov. There's a whole bunch of them. That's the same place that we looked at for the cardiac calculator as well. So this is just telling you pretty much what you can do with your blood pressure, what's it mean. It's got questions to ask the doctor. So anything that you might need can be found like right here. All right. But again, don't be afraid to ask questions. No question is a dumb question. The questions that you don't ask are the ones that are going to hurt you. All right. Next slide. Like I know you said you didn't take any medications, but I'm sure some of you, the other ones you guys do. We gotta make sure that we're taking our medications and taking them as they're prescribed. There's many ideas and tips on the website about how to set up a system to make sure it reminds you. There's things on there that you can ask your doctor, hey, what are the side effects of these medications? I don't know if I can live with this side effect, is there another medication that I can take? Or some of you might not have the best insurance and the prescription is a lot more than you can afford. So that's another thing that you can talk to your doctor about. Is there something else that I can take that'll help that doesn't cost as much? Another thing is at Walgreens they have those little pill cases. Maybe that helps. You know, you can put your whole month in there if you want, or you can get one that just like does a weekly basis. You know, it's your choice. The second one is making healthy choices. First things first, knowing how to take our blood pressure is going to be huge. Knowing how to take your blood pressure and being able to monitor that is going to help you a lot. It's going to help you set goals, and it's going to make it easier for you to make the right choices so you can actually see improvement as well. But you're also going to want to make sure that you're exercising, and you should talk to your doctor before you get on an exercise regimen to make sure that your heart is healthy enough to do that exercise. You want to eat better. Fruits and vegetables are great, and it kind of goes in this order. If you you can't get fresh fruit, frozen fruit and vegetables is the second best. You should stay away from cans. Cans have a lot of preservatives and stuff in it. Actually, it's not that great for you. So you should always try to go fresh, then frozen, and then if you have no choice, then canned is better for you. Also, smoking. Smoking is huge. Smoking raises your blood pressure, and it affects your cardiovascular system as well as your lungs. It makes your arteries harden, so that's going to also affect your blood pressure. They say after 24 hours your blood pressure starts to return to a normal level. There's a lot of tips on the internet about smoking as well. So you can go to smokefree.gov is a great one, and it's got tools on there, and it kind of has a checklist of the timetable of, hey, when I quit smoking, after a day it does this, after 2 days it does this, and so on and so forth. But some approaches that people use, and it seems to work pretty effectively, is don't tell yourself you're going to quit smoking, just don't smoke today. See how well you can make it through today. And if you can make it through today, go to the next day. All right, I made it one day, let's see if I can make it the second day. You're not quitting yet, you're just kind of putting a whole bunch of string of days together. And then once you feel like you've put enough of those days together, then you can say, hey, I quit. All right. Again, the next slide is again about smoking. Smoking is a huge one. I mean, it's really big, especially in this area. There is a lower poverty line. The annual income in this area is lower than the state average. And if you drive around, you'll see a lot of people that are smoking, and maybe they don't have that education. There actually has been a relation or correlation between smoking and poverty, because they don't have the resources, or maybe they're not getting the right information about quitting smoking. Also, again, this is smokefree.gov. There's a whole bunch of tips and tools on there. So again, we have Million Hearts that has many tools, many resources, many things that you can go on and look for as far as questions to ask the doctor. I think I have another one up here. It's just about, it's talking about monitoring your blood pressure, making the healthy choices. It talks about the tools, and then it talks about knowing your goals and setting your goals. So when you're going to the doctor, you actually have something, to measure and make sure that you're doing well. Also, the nurse practitioners here, once a month and at different locations, they do it here at Gateway, and they also do it at Christian, and I believe DePaul, and different clinics that they do. One time it's about monitoring your blood pressure, how to check your blood pressure, what's the importance of your blood pressure. They have one about CHF or congestive heart failure, medications. There's different topics every month, and there's different locations, whichever one's easiest for you to find. Okay. Alright, so that's it for the PowerPoint presentation. Is there any questions from anyone? Okay. That's pretty much it for my presentation. If you guys would be so kind to fill out a survey for me, that would be great. Thank you again for participating in this, and hopefully they get you back into your appointment soon, and you can all go home and continue on with your day. All right, thank you.